So, welcome back to the Prescription to Travel MD podcast. I'm your host, Dr. Courtney Downes. And, I was speaking with someone the other day about hosting a podcast. And one of the most enjoyable things about hosting a podcast is just being able to meet so many interesting people who are just doing such cool things in the travel space. And so, our next guest is no different. I'm really excited to speak with her. We had with us Dr. Robbie Harriford. She is the founder of Modern Traditions Travel, which basically has a mission to foster cultural awareness and ultimately improve patient care, which she's going to tell us all about. Thanks so much for joining us today, Robbie.
Thank you for having me. I'm so excited to talk about us.
So tell me a little bit about your background. How'd you get started?
Sure. So I am a board certified family medicine physician, and my job is that I'm a chief medical officer at a federally qualified health center here in Kansas City, Missouri. I just do women's health. I actually started off as an OB-GYN resident and then switched into family medicine. So I was able to kind of be more all-encompassing with the women's health care with that switch. So it was great for me. This is a clinic that is extremely diverse. We have about 40 different languages that are spoken. And I would say about 60% of our patients are best served in a language other than English. So through my years here, I'm on year 6, I've really come to realize the importance of culture and how that drastically affects our patients and their ability to adhere to whatever we're doing and just their health in general.
And I think that's so important when you're practicing in any city, but particularly when you're working in a major city. And, people don't think of Kansas City as being like, a major city, but I train there. And so very familiar with the population and see the diversity that exists there. So I can imagine what it's like working in other places that are even more culturally diverse.
I think I'm kind of born and raised here for the most part. And I myself was surprised at the amount of diversity that I've seen in this clinic. And doing residency back here was when I was first kind of reintroduced to Kansas City. And I was like, wow, this is incredible. And the reason is because we have 2 major interstates and we have several resettlement agencies here that also help. But you're right, most people don't realize Kansas City is a hub for diversity.
Awesome. Okay, so you're working there in the clinic and you thought, we need to learn a little bit more about our patients so that we can take better care of them. And what did you do?
So it was kind of a slow process. I'm bilingual, so I speak Spanish, and which helped me out. But even then, there was still a little bit of a disconnect with the patients. And there was one specific instance with the patient who was from Afghanistan, and it really caused me to pause. So basically, we had a large number of Afghan refugees come through. And I was noticing that the patients weren't really coming to all the prenatal visits. And, in the Western world, there's like 10 plus visits that you're supposed to come to, which in our mind is not a lot. It's like, yeah, this is what we do. But for them, they just weren't coming. And so, implicit bias, I was getting a little frustrated about the situation. And then I started researching and found a webinar that was like specifically for OB patients from Afghanistan. And it really made me change how I think about things. So what I found out is that women from Afghanistan often only go to like about 4 visits. And a lot of the times it's only 2 visits. And that was kind of like my aha moment where I'm like, wow, we're really trying to have women who are just coming here assimilate to what our standards are, not taking into account their background. And so I realized when I do see them, I need to do as much as I can for them. But then it got me thinking about like, if I'm feeling this way, and I feel like I'm pretty good when it comes to this kind of stuff, a lot of other people in this field are probably feeling the same way.
So you saw a problem and you decided you were going to fix it,
Yeah, that's the plan. Yeah.
which is how all great ideas start, right? And so you decided to create Modern Traditions Travel. Tell us a little bit about that.
Yeah. So we are a curated travel company for healthcare professionals. And really, it's not just for doctors, nurse practitioners, it's literally for anybody involved in the healthcare sphere. So you could be the CEO of a hospital and want to come on this. You could be a part of a nonprofit that helps with clinics. And the goal is to really immerse you in different cultures. And initially, my thought was to focus on the different cultures that we see in our clinic. And so Hispanic, Latinx cultures, a lot of African cultures, Asian cultures. And then I just kind of grew and I'm like, why not go bigger and try to do something global for people as well? We also do local experiences. So we can work with different organizations to create kind of like different retreats based off of your learning objectives and your ability to want to learn more about culturally responsive care.
All right. So, how does this work exactly? What kind of walk us through what someone would experience if they joined one of these programs?
Sure. So, for instance, we have a trip this fall to New Orleans, and it is specific for the African American culture and the intersection of health. So, this particular trip is 4 days long, and each day is a different theme. So, the first day is roots to resistance. And so, we're taking it back. We need that historical perspective to understand. So, we'll do things like visit a plantation, and not just any plantation, but it's one that's specifically from the viewpoint of the enslaved. So we start you off kind of heavy. We want to kind of get that out the way first, get the tears out the way, and realize we're going to move in a positive direction. And then we do other fun activities like food is a big part of culture. So we're going to eat in different restaurants that really embody the African American culture. We're going to be doing different scavenger hunts through different neighborhoods. So Treme is the oldest African American neighborhood in the country. So we're going to specifically going through there and the lower Ninth Ward, which was hit very hard by Katrina. And it's also the 20th anniversary of Katrina this year, so very appropriate. So that particular part is more with like the social determinants of health. And then just it's an opportunity to learn about the city as a whole. And my goal isn't to just like have it like 8 to 5, you're doing something. I want you to be able to have the opportunity to explore on your own as well.
And how do you find people like collaborators and people who can give you like an authentic experience and really educate you on what to expect if you're working within these communities?
So there is a lot of research that goes into this. So I'm online looking up things. I have my own connections through my own travels. So I often will reach out to people through that. Just connections through medical school as well. So for the New Orleans trip, one of my medical school friends did her residency there and her fellowship there. So she was able to give me information about different providers who would be able to come to talk to the group. And then once I reach out, it kind of just spreads. People love the idea so much. They're like, "Ooh, have you heard of X, Y, and Z? Here's their contact. You should reach out." And for me, that's the best way to do it because that's really authentic. And it's coming from the perspective of like, I see what you're doing. So I think we can enhance that experience.
Do you plan like hotel stays and all those things?
So it is very inclusive. So whenever you see a price on our site, it will include certain things. So it will include your hotel stay. You can choose from like a double room. So if you want to go with a friend, there's that option, or a single room. It includes a lot of the meals, not every single one, but for like our New Orleans one, breakfast is included every day, pretty much dinner as well. And then all the activities that we are doing, as well as transportation to and from those activities.
Good deal. And so you said this isn't just open up to physicians and nurse practitioners, but it's open to anyone who's in healthcare or?
Exactly. And I think that's really important because another part of this experience is learning to interact and learn from other people. So this isn't just for people from Kansas City, this is worldwide. And so learning from a dentist from Virginia or a dietitian from Hawaii, coming on there, hearing about their experiences also just kind of enhances what you're going to experience too. And it just creates a sense of connection and community, which is ultimately like one of our values.
And then how do you feel having these experiences are going to actually impact your practices? Because it's one thing, you go to New Orleans, you go on a trip, you eat some food, you have a good time. Maybe you learn about Mardi Gras, but how is this really going to change what you take back to your practice?
So I think listening to what people are saying and the feedback from patients even is that healthcare providers aren't listening to them. We see that with the studies. And when they feel that people aren't listening, that's when the outcomes aren't great. You lose that lack of trust. There's not an idea of collaboration. So the idea behind these trips is to foster that sense of trust because now you've developed empathy. So when you're coming back, let's say you're going on one of our trips to like a Latin American country, you may not be able to speak Spanish. You may not have any experience with some of the other stuff. But in your conversations with your patient, you find out they're from Mexico City. You can be like, "Oh, I went to Mexico City and I learned about traditional midwives. Have you used that in the past?" Or, you're able to connect on a different level with your patients. So when there's that trust, they're going to listen to you when it comes to your advice because you're taking into account where they came from. You understand that their culture is one that, let's say, if they're a diabetic, has a lot of carbs in it. It's not realistic for us to tell the 60-year-old newly diagnosed diabetic, no more tortillas, no more rice. But you can talk to them in a way because you've experienced that environment now about like, maybe take those tortillas down to like 5 days a week for a little bit, keep going down. So there's just that understanding and integration of the culture.
I think I read a quote somewhere that said, people don't care what you know until they know that you care. And I think once I heard that, and it was like probably like a few months ago, and like every time I go into a patient's room, like that thought just kind of lingers there. And sometimes I have to take a step back and realize, like I'm telling you to do all these things. These are all things you need to change. Yes, you need to take your blood pressure medication. Yes, you should lower the amount of salt that you're including in your diet. Yes, you should eat fewer carbs, but it's easier said than done, right? And it's also easier to, I guess, incorporate those things if you know it's coming from a place of care, like someone who really cares about you and they really want you to succeed versus just like some doctor who's like barking orders at you.
Yeah, I think the issue is that medicine is very cookie cutter. We go to school, we all learn the same thing. We all learn this, this, and this. But what it doesn't teach you is that you could take 3 patients and they're all going to react a little bit differently to what you're throwing at them. So this is an experience that allows you to kind of individualize a little bit more, but still using what you know. It's more about creating a partnership with your patients, which is really, really important, especially nowadays. We hear all the time about the different effects from a lack of attention or not understanding. And so I think this is a really timely experience for people to have.
And so, do you have ties to New Orleans?
So, no specific ties. The Baton Rouge area, yes, I have cousins that live there. I chose it just because of the history, because I knew right away I wanted my early trips to focus on African American culture for obvious reasons. But New Orleans is a city that is so rich with culture, and it's just a fun city. So, I want you to go on these trips and learn, but it's also about your well being too. So, it's a good mix with it.
And when is this trip happening?
It's September 17th through the 21st.
So September 17th through the 21st. So you can still sign up now if you're interested.
Absolutely. We have a few spots left.
And you say trips. So you have future trips planned?
I'm in the process of planning a few more. I speak Spanish, like I said. So the next destination will be a Spanish-speaking country. I won't say where, but I'm very excited about a lot of the things that we're going to be doing on this.
Awesome. And so this will be the first trip that you're doing.
Correct. Yes.
And when is the deadline to sign up for the trip?
So ideally by May 1st.
And how do you see the future of modern traditions travel?
I want us to be on every continent except Antarctica for obvious reasons there too. I think the idea of going to Africa is extremely interesting. There's not a lot of trips other than like medical mission trips that go there. And so one thing to note with these trips, that it is not clinical at all. You're not going to be going there and doing blood pressures. I feel like we get enough of that. This is purely cultural and the social aspects of it because it's a part that's really kind of missing out. So I think going to a place like Rwanda that has a really strong healthcare background would be amazing. And a lot of the Asian countries too. I think Japan would be really cool. South Korea, obviously Vietnam and Thailand.
It's great that you pointed out that it's not medical. So you're not going there. You're not doing any type of medical missions work. You're not going to be in the hospitals. You're not going to be in the clinic. It's purely to experience the social environment that people are coming from.
Exactly. And we will have interactions with healthcare professionals. That's a key part of every trip. And in fact, that's how we start it. So there'll be a meet and greet and there'll be local providers that we can mingle with and they will give their perspectives on the care. So they'll talk about the healthcare system. They will give us like their day to day. And then they'll also talk about what they wish people knew. I think that's a really important aspect. And then we invite them back at the end at our final dinner so we can all have a conversation about the things that we've learned and the realizations that we've had. And then just to kind of connect a little bit more.
Are there going to be any like formal lectures or is it all just?
So there won't be formal lectures. I really wanted this to be relaxed, but there's a lot of learning involved.
All right. Is there CME available for the trip?
We're in the process of obtaining that through a bunch of the different organizations. So that is my goal. Yes, that would be the ultimate.
Yeah, I know. I always emphasize being able to use your CME credits and I guess using your CME as an opportunity to travel because, you have to get your CME requirements met. A lot of times your employer will reimburse you for CME travel.
Exactly. You get those days. It's surprising the number of people that don't utilize their CME days. And I'm like, why? Because you're learning and you get to be in a really cool place to do it. So use it.
That was us for a very long time. Yeah, I don't think we even realized that we had CME days until we did it one time and we're like, "Oh, that's how this works? Okay." I think it'll be a very cool opportunity, especially if someone's looking to go somewhere and they don't wanna travel too far and they don't have a lot of days to actually travel and they want a somewhat immersive experience, or maybe just to check out New Orleans or a new city.
That's also one of the reasons why I picked it because it's domestic. It's a short enough trip. I think eventually there will be some longer ones if people want it, more like 8, 9 days. But to start, this is a really good kind of like baby trip to like get your feet wet and then come on some other trips with us.
Awesome. And so if they go to your website, they'll have access to details about the trip.
Absolutely. Yep. And it's moderntraditionstravel.com. And there's information about the New Orleans trip, about local experiences if you want to connect, and I can help you guys organize that. And then just more information about just facts and about culture in general. And same with my Instagram page.
Okay, so they can find you on Instagram as well.
They sure can. It's actually modern_traditions_travel.
So they should connect with you either on Instagram or check out your website for more information if they're interested. Anything else that you want to leave them with before we part?
No, I would just love to have everybody on this trip. It's going to be a great time. You're going to learn a lot. You're going to learn more about yourself as a provider. And if you guys have any questions, please reach out.
Thank you so much for being here with us today. I'm sure there are people who will want to hear more about what you have going on, and maybe they're interested in international travel or some of your upcoming trips. Is there like a wait list or an email address?
If they just reach out to us, that would be the best way. I'm also always looking for any recommendations from people. So if there's a location that you'd be interested in, I could definitely look into that a little bit more too. We have our next 3 international locations decided on, but we can always add to the list.
All right. Well, thanks so much for being here with me today, Robbie.
Thank you.
And we'll talk to you guys again soon.